Do you know what trauma-informed care is, and are you practicing it in your hospital? If the answer is no to either of those questions, you're going to want to listen to this video. So if you work in a hospital or a medical setting, or you work with children in some capacity in the community, you've heard of trauma-informed care, hopefully. And if you haven't, we're going to go over it quickly today. There are 3 pillars to trauma-informed care in providing it. The first one is safety, the second one is connection, and the third one is managing emotions. So as you are walking through experiences with the children and families that you're caring for, those 3 things should be at the forefront of your mind always. Let's start with safety. As you know, if we are not able to feel safe, we are unable to cope with much more. Safety is the foundation in which we are able to cope with what is happening in our life. If we don't feel safe, we move to a different response in fight or flight, and we're not able to cope as well as we normally do. So safety is an important part. When you're talking with families, it's okay to ask the questions. Do you feel safe? Or tell them, you're safe here. I'm going to make sure that I'm keeping you as safe as possible, and that is my priority. That is my job. That's a huge thing you can do for families and children to help them feel safe and provide that trauma-informed care. The second pillar of connection is incredibly important, and what you're doing is you're providing an opportunity for patients and families to connect with one another. They don't want to feel isolated. They want to know that someone else is walking through their shoes. There's a multitude of different ways that you can do this, and that's offering maybe a blog that you've seen before of a family who's gone through something. If you have a playroom or an activity room in which you can join families together, if you can ask to exchange numbers, if you have a family that's really coping well, and ask them if they're interested in mentoring another family. There are podcasts that families can listen to. It's an extremely passive way to feel connection with one another. And so you want to make sure you're offering connection to families in some way for them to meet one another, for them to find that community that they're so longing for. The third one is managing emotions. Trauma-informed care allows children and families to manage their emotions. So we're giving them an opportunity to learn and practice coping skills in the hospital. If you don't know if something is going to happen, then you don't know how to cope with it. And if you haven't practiced it, you might be doomed to have a worse experience than had you been practicing a coping skill. You know what to do. Because child life specialists have such a unique skill set in the hospital setting, they are a wonderful resource for hospitals to look to make sure they are providing trauma-informed care. And if you don't know where to start, starting with a child life specialist is a great way to do it. If you really like this tip, then take a look at some of our other videos and our resources at childlifepodcast.com. And we are having our new app, which has all of this information, as well as opportunities for trauma-informed care, like connection through podcast stories and hearing other parents, information about managing emotions and what some families are feeling. So that is available coming up next month, and I cannot wait for you to see it. But thanks for listening today.